Welcome to today's video. In this session we'll explore dopa-responsive dystrophy, a rare but fascinating neurological condition. We'll discuss its causes, symptoms, diagnosis, treatment, and why it's one of the few neurological disorders that can be completely reversed with simple medication. Introduction. Dopa-responsive dystrophy, also known as Sagawa's disease, is a genetic movement disorder first described by Dr. Masaya Sagawa in 1976. It is characterized by muscle stiffness, tremors, and abnormal body postures that worsen during the day but improve after rest or sleep. The most amazing part: these symptoms respond dramatically to small doses of levodopa, the same drug used in Parkinson's disease. Epidemiology. Dopa-responsive dystrophy is a rare condition, affecting about 0.5 to 1 person per million worldwide. It is seen more commonly in females, and symptoms usually appear between ages 5 and 10. Unfortunately, because of its rarity, DRD is often misdiagnosed as cerebral palsy or other neurological disorders. Occurrence and genetics. DRD is usually inherited in an autosomal dominant manner, meaning only one copy of the defective gene is enough to cause the disease. Some rare types show autosomal recessive inheritance. The condition primarily affects dopamine production in the brain's basal ganglia, the region that controls movement and coordination. Signs and symptoms. The main symptoms of dopa-responsive dystrophy include muscle stiffness, especially in the legs, abnormal walking pattern or toe walking, twisting movements and unusual postures, known as dystonia, tremors and slowness of movement, symptoms that worsen during the day and improve after sleep.
Some patients may also experience fatigue, speech difficulties, or mild tremors.
Causes and pathophysiology. The root cause of DRD lies in a mutation of the GCH1 gene, which produces an enzyme called GTP cyclohydrolase 1. This enzyme is essential for the production of tetrahydrobiopterin or BH4, a vital cofactor for dopamine synthesis. When BH4 levels are low, dopamine production drops, leading to the motor symptoms we see in patients. Other rare gene mutations, such as TH and SPR, can also produce similar conditions. Diagnosis. Diagnosing dopa-responsive dystrophy involves several steps: clinical evaluation, identifying muscle rigidity and dystonia, levodopa response test, a remarkable improvement after low-dose levodopa confirms suspicion, genetic testing, detecting GCH1, TH, or SPR gene mutations, CSF analysis, checking for abnormal neurotransmitter metabolites, MRI or CT scan, usually normal, but helps rule out other disorders. Treatment. Treatment for DRD is simple yet life-changing. The main therapy is low-dose levodopa combined with carbidopa. Most patients experience near-complete recovery, often within days or weeks. Unlike Parkinson's patients, DRD patients rarely develop long-term side effects from levodopa. Physical therapy, speech therapy, and psychological support can further improve quality of life. Prevention and genetic counseling. Since DRD is a genetic disorder, it cannot be completely prevented.
However, genetic counseling helps families understand inheritance patterns and plan for the future.
Early diagnosis and treatment are key to preventing lifelong disability and ensuring normal development. The prognosis for dopa-responsive dystrophy is excellent. With timely diagnosis and proper treatment, most patients live completely normal, independent lives.